Welcome to the demonstration and overview of the Welkin Health Care Portal. The homepage consists of a series of widgets that are set up on the designer side of the platform based on your role. In the situation here, our role as a physician includes a couple different pieces of information. This, of course, is all customizable based on your programs. What I have on the screen today is a grouping of patients in particular phases of their healthcare journey, a view of the number of patients that are in different programs, some volumetric information around email and SMS, a list of appointments for the day, and then windows for either unrecognized text messages and or unrecognized email messages. This screen can incorporate many other additional elements. Most of the work in Welkin will be done at a patient level, so let's jump over to see the patients. My role as a physician here gives me the ability to look at this grouping of patients you see on the screen. Every Welkin user is assigned roles and security policies that will determine which patients and which data they're able to see. My role gives me the ability to see the list on the screen. After jumping into one of our patients, we'll take a look at some of their individual information. Navigationally, on the left-hand side, you have the patient's demographic information and then the ability to edit and add information there. Underneath are a series of links to communication platforms, such as email, SMS, phone calls, chat, and then we have the option of adding additional links to video or perhaps even outside organization websites. Underneath that, I have a number of different data sorts that have been set up in the system based on our parameters. Right now for my physician, I have the 5 views here and then a standard view of assessments and documents, which we'll cover in a few moments. These views are all customizable based on your program, as well as all the information that's contained within those views. In our current situation, our clinical summary has a few different data elements. We start off with a conversation note that takes up just a small portion of the screen and gives only the most recent note information. And then we have some more sequential information for allergies, hospitalizations, and medications. This is all customizable within the Welkin Designer side. We also have another few views under the patient notes and summary. You'll see a couple of pieces of information side by side, and then again, a series of sequential information. The Welkin system also gives you the ability to graph results of assessments or numerical results over time. What I have here is some information on A1C levels as well as blood glucose. Under trending data, you'll see some additional examples. For blood pressure, I actually have 2 different elements graphed on the same chart. You have the ability to stack multiple data elements on one graph, and then if you'd like visibility into a particular element, you can always just click off to hide other elements. Again, any of these graphs can be shown either in the larger view as up above or the smaller view, such as in this weight over time graph. Again, all of the information that's here and visible is based on the security rules that are built out within the platform. I'd like to show you an example of how that works. Again, to reiterate, I'm logged in as a doctor role currently, which gives me the visibility into the 5 different data sorts here. If I go ahead and change my role to perhaps a care coordinator, you'll now notice that I've been reduced down to 3 different views. So not only am I able to show only the pertinent information that's available and necessary for the role, I can actually make security rules that allow a user based on role to either edit, add, or delete information, or to remove those capabilities completely. This is a customization that's built so that every individual user has exactly the access they need, and we're not putting any unnecessary clutter or information that shouldn't be visible to certain users on the screen. Moving back into my doctor role, we'll take a look at assessments. Assessments are a formatted way of entering data into the Welkin system and be completed by users of the Welkin who are care providers or can actually be sent to patients for completion as well. I've gone ahead and started a couple here, so I want to show you how this works. When you start an assessment, you can choose it from the list that's available to you, again, based on security rules and also based on where in the progress of this medical treatment program your particular patient is. Any assessment that you begin can be put in a pending situation by either clicking off of the assessment or pressing finish later. That way, if you get pulled away while you're having a patient conversation or you've already started to enter information, you don't lose that information. We'll go ahead and discard these changes. Any information in the system is updated in real time. So we'll go ahead and we'll go into this vitals entry that I've already begun, and I'll put in some information on blood pressure and weight, as well as oxygen sat. Once I complete this assessment, I can go back to my training data and I can see an immediate result for that information. Another neat thing you can do is if you see a particular drop or spike in one of these graphs based on results from the data that's been entered into the system, I can actually go ahead and click right on that. It will open up the assessment and show me the values in question, giving me the easy ability to see what happened to make that change. This is especially useful if you have an assessment that you're using to score. A PHQ-9 is a standard type of assessment that generates a score. So what I've done here is answered all the questions. I'm going ahead and complete this assessment. Now I can go ahead and look and see that this PHQ-9 had a score of 12. If I were to graph that information out on another trending data graph, I could click on this result and immediately jump into the answers to see what happened to cause either a drop or spike in that score. Assessments again are visible comprehensively with the ability to sort them by the user who entered the information, in this case myself, or even the patient themselves, or what the assessment type is. Documents is another interesting area of the Welkin platform where you can store information based on your exact needs. When you build the system, you'll assign different document types that you may want to have visible to you. In our case, I have medical records and a few other options. So if I wanted to enter a new medical record, I've told the system whenever I upload that data file, I also would like to include a manual entry of the date that record was recorded, as well as what type of a visit was that. Once I upload the file and save, the system is actually going to generate another record, and anytime that I need to search, I can search by the particular criteria that I've built out. So right now I have one record for an ER visit. If I were to search for ER visits, once I have multiple records, it will pull them front and center so I can easily access the appropriate record. Jumping over to the communication portal, we have the ability to send email, SMS, chat, calls, and then video as well. So right now, many patients are using SMS, so let's jump there. I have the ability to send out a SMS message ad hoc by just clicking on Send SMS, and I can type in information. What I can also do is use a patient-facing assessment that's already been built in the system or a template that we've built. So let's just go ahead and do this, social determinants of health. You'll see the information automatically populating. By hitting send, it would send this assessment directly to the patient. The great thing about this, once you've sent that assessment, you will see it as an in-progress assessment. Once completed by the patient, the same rule will apply. It will immediately update any of the trending data that's been built out. A final thing that I'd like to show you before we jump into tasks is the calendar. To set a calendar appointment, all I need to do is click on a particular time on the calendar, give it a name, set the time and duration of the appointment. I can associate this appointment with a individual patient if I'd like to, set what type it is, and then give a description. Once I create that appointment, I'll immediately see it on the calendar, as well as on my home screen if that hasn't passed for the day. Another interesting aspect of the Welkin system is the ability to create tasks for other users. What I have here are 3 different tasks that are in the system under different priorities. So let's go ahead and create a new task. What I'll do is I'll first just give this a name. I can add a description if I'd like, and then I can associate it with a patient. By starting to type the name of the patient, I will get a pull-up. And then in this case, let's go ahead and assign the task to Otto. I'll set a due date, and then I'm going to make this a high urgency task. I can also add any additional comments if I'd like. Once I create that task, Otto's going to receive a notification, such as this bell with the little red dot next to it, under his profile to let him know he has a new task. In addition, because I am the individual who set this task, I've been set as a watcher of the task. What that means is even though I don't have to take any action on this task, as Otto takes that action, I'll be given updates. When he goes in to do that task, Otto will have the ability to change the status of the task. So the status will start off as not begun. We can choose it then to in progress and then completed. Once the task is completed, you'll see that different status here. And again, you have the ability to sort any of these tasks based on the task name, patient name, or many other factors. Thank you for joining me for a walkthrough and overview of the Welkin Health Care Portal.